So after the hip replacement is inserted entirely and we put the final head and liner in, there's a few other tricks that we do to reduce bleeding and reduce pain. So we're very careful. The blood loss is not very much at all, typically a couple of hundred cc's maximum. We have procoagulant materials that we put in the wound. We also give you an intravenous medication that helps keep the blood loss down. So typically the blood loss is very low with this technique because it is less invasive. At the end of the procedure, in addition to the procoagulant material, we have a long-acting local anesthetic. There's two types of local anesthetic that we use. So before we close the wound from the bottom of the hip all the way up to the top, we put two different types of injections in the soft tissues from bottom to top. There is a long-acting local anesthetic called Exparel. It's basically what's called a liposomal bupivacaine. So bupivacaine is sort of like the Novocaine that you get at the dentist. The difference is this is very expensive medication. It costs hundreds of dollars per vial, but it's in these small microscopic capsules. If you think of like a delayed release medicine that you take by mouth, we inject it into all the different tissue plane levels, and it literally gets leached into the tissues over 48 to 72 hours. Most of our patients wake up with very little pain, and because it's a long-acting local, I would say 90% of our patients take nothing but Tylenol and Advil after this hip replacement. Very few people require narcotics, and if anyone needs pain pills, it's typically only for a few days or so. Because of this medication and because we're not cutting muscles and tendons, it's really much easier for patients to recover. Now, as a rule of thumb, I would say patients recover by 5 to 7 days. I would say most of our patients are off all of their assistive devices. They don't need walker, cane, crutches. They're walking on their own, and they're off any type of narcotic. In terms of return to work and function, people always ask, how quickly can I go back to work? It really depends on what you do for work. I've had orthopedic surgeons that I've operated on who are anxious to get back to work for some reason, and they've been off work for a week and back at work a week later. In general, it's 1 to 2 weeks off work for most folks. If you have a heavy job where you're a laborer or you're lifting or a very strenuous type of vocation, you probably need 4 to 6 weeks for the same reasons we talked about with the ingrowth of that implant into the body. But if you have a desk job or something that's not too vigorous, you could easily go back to work after a week or two. And it's really just limited by your pain tolerance and your ability to do the physical therapy and the stretches and some of the simple exercises that we give you after surgery. So we've come a long way with hip replacement in the last 10 years, that's for sure.